Calcium channel blockers, very important topic, because most of the time when when the drugs you're talking about, according to the cardiovascular system, always there this calcium channel blockers, CCBs. So classification first, it's first uh, phenylalkylamines. So drug is verapamil. Benzodiazepines, drug is diltiazem. So these two things, phenylalkylamine and benzodiazepines, verapamil and diltiazem, these are non-DHPs. DHP means dihydropyridines. So those are non-dihydropyridine drugs. Dihydropyridine drugs, mnemonic is NIF and ball. NIF and ball. uh, N, it's nimodifine, nifedipine, nicardipine. Nimodifine nowadays very used vastly. F for felodifine, B for benedifine, A for amlodipine, L for lecidipine, L for uh, lecanidipine. So you have to know these every calcium channel blockers, these DHPs, dihydropyridines, all ending is define. So when you see a drug ending in define, you have to know this is a DHP CCB. All right, it's calcium channel blockers which is belong to dihydropyridines. So mechanism of action of dihydropyridine: decrease calcium influx and decrease contraction, smooth muscle dilation and vasodilation. So that is the mechanism of action of calcium channel blockers. Indications: mainly calcium channel blockers indications for angina pectoris. They dilate coronary vessels in angina pectoris and increase blood flow. We will talk what is angina pectoris more in angina anti-anginal drugs. And also there's a mnemonic chiasma. uh, so these could be used in cerebral vasospasm, hypertension, angina, supraventricular tachycardia. We talked that in antiarrhythmic medication CCB is also used. So in supraventricular tachycardia, these specifically supraventricular tachycardia, CCBs could use. M for migraine. What is migraine? Migraine is pulsating type of headache, which is more likely to have familial predisposition, type of headache, that with aura or without aura. 20% without aura, with aura. 80% without aura. So there's a migraine, so it's a common problem. So calcium channel blockers could be used in migraine. A for atrial flutter and atrial fibrillation. So supraventricular tachycardia, atrial flutter, atrial fibrillation. Or as an antiarrhythmic medication, calcium channel blockers could be used for those these three arrhythmias: supraventricular tachycardia, A flutter, A fib. You could use. So side effects: uh, non-DHPs, verapamil and diltiazem. Side effects are bradycardia, constipation, and hypotension. You have to know this, non-DHPs, they act on SA node. So they reduce the heart rate. That's why its side effects is bradycardia. And also constipation, hypotension. The constipation mainly due to the smooth muscle relaxation. Peristalsis will be slowed. That's why constipation occur. And hypotension is due to smooth muscle vasodilation and hypotension occur. And DHPs mainly side effects as headache, reflex tachycardia. When smooth muscles are dilation as a reflex, it will try to increase the heart rate. And flushing is peripheral because of the peripheral vasodilation. You could see in pace that red color, and hypertension. So those are the mainly about calcium channel blockers. This is not actually very difficult topic. You have to know what are non DHPs and what is DHPs. So DHPs, what is the mnemonic? Sniff and ball. Nimodifine, nifedifine, nifcardifine, philodifine, benedifine, amlodifine, lecidifine, lecanidifine. So what is the mechanism of action? So it's the calcium channel blocker. No? That is the mechanism of action. Calcium channel blockers, they block the calcium channel. So influx of the calcium decreased. So for smooth muscle contraction, you need calcium. No, without calcium, it can't be contracted. So the name itself suggests what is the mechanism of action. So it will be dilated, cannot be contracted. So indications: angina pectoris mainly, uh, dilate coronary vessels, and chiasm, cerebral vasospasm, hypertension, migraine, supraventricular tachycardia, AFib, flutter, and side effects. Here, so you have to know non-DHPs mainly they act peripherally, and also they act in heart in SA node as well. DHPs doesn't act on SA node. So they act only peripheral vessel.